Hello, everyone. Welcome to today's um, Coventry HDRC webinar. Today we'll be speaking about all system approaches to public health, what they are and how they can be evaluated. And today we have with us John Wilcox, who is the head of the Coventry HDRC within the council here, and he has 14 years experience of delivering, planning, and commissioning public health programs in various fields. So I'll hand over to John now, who will take us through the session. Thank you, John.
Hi, thanks, Michael. Welcome, everybody. So as Michael said, my name's John Wilcox. I'm part of the HDRC team here at Coventry City Council, and I volunteered to do one of these webinars. So the topic I'm going to talk about, as Michael said, is whole system approaches to public health, and the reason I volunteered to talk about this as part of this series is because it's a subject matter that I'm interested in and that I've used myself, both in terms of my own public health practice, but also it's a relatively new and innovative area of public health practice, which is also quite a big area of research. So it's applicable to both research and public health practice, and when I say research, also evaluation. So I hold my hand up. I'm not an academic researcher in this field, and no doubt there will be people on this call who know more about this subject matter than me. So if you've got any comments or suggestions as we go through it, please put them in the chat. Pitch the session at quite an introductory level. So again, if you feel you know more about this, please engage in the discussion. I have included a couple of interactive elements to the webinar, so Michael's going to help facilitate those. So that'll be in form of a word cloud that you can contribute to, a poll that you can contribute to that will pop up on your screen, and also I have built in 2 breaks for questions and thoughts. So depending on how we do with time over the next hour, we can use those. Okay, so what I should say is what we're going to cover. So I'm going to cover 3 things. So first of all, I'm going to cover what we mean by a system and the characteristics of systems. And we're going to cover a little bit about systems thinking in public health. I'm going to finish off with going into a little bit more detail into a couple of methods that can be used in public health evaluation and practice. Okay, so going on to the first section around system thinking. So system thinking is relatively new in terms of public health, but it has been around in academia for around 30 years. And there's whole disciplines looking at system science, system approaches. When we learn about public health or anything in education, we tend to look at things in isolation and in fragments of issues and in disciplinary silos, but whole system thinking is really starting to think about how do we look at things in the round and the whole bigger picture of an issue as a system. I mean, interestingly, one of the quotes that I've put on this slide is that obviously in wider culture, lots of cultures in human history do think about the world and things holistically through their culture and philosophies, how they relate to the world and nature. So it's sort of, the way I see it is sort of as though when you take a system approach, you sort of stepping back and looking at things in that bigger picture and looking at the interconnection between things. So one of the first times I came across systems approaches was way back in around 2007, 2008, when there was an important piece of work in public health around the obesity agenda done through a government agency, through which was called Foresight, and that created a whole system match, which we'll go into a bit more detail, system mapping later on in the session. And this really looked at obesity and its causation and the complex web that causes obesity, and that's the system map. Yeah, I was interested actually to ask in the chat who's actually seen this Foresight system map before, because I say for me it was really one of the first times that I heard about system approaches. But I think in terms of sort of public health practice, although this sort of system mapping as part of a system approach was looked at way back in the 2000s, really nearly 15 years later, it's really still not used that much in public health practice. And I understand through university courses either. So, I'm interested to know anybody on the call who's in the past 5 years or longer, if you did a university course in public health, were system approaches included in that or not, or is it a new area? So any thoughts on that, please put them in the chat. Okay, so now we're going to go on to a bit of a poll that Michael's going to make appear. So the first bit of the quiz is, if you think about a system and what that means to you in your mind, which of these things on this screen could be part of a system? So you've got a picture of me, you've got a spark plug, you've got a pile of money, and you've got a tree. So Michael, are you going to bring that up now? Yep, so what you have to do is click on this and say, which of these do you think is part of a system? So I guess when you're doing it, think about, okay, why is this part of a system? What does a system even mean? So yeah, we're getting some answers through there. Just give it a little bit more time. Okay, so yeah, what we're getting through there is that people are saying that the object that's got the most responses is the tree, and then the money, and then me, and then the smart plug. So let's see what I came up with when I was putting the presentation together. Okay, so if you think about a picture of me, so as an individual, I guess I can be thought of as part of a social system. So in this case, I've done a picture of from last year of in a workplace setting, of our collaboration of our HDRC. So in that social circumstance, I'm part of a social system. So spark plug, that's part of an engine, a working system, mechanical system. Money on its own, maybe not, but money is part of the economic system. So the tree is in itself a biological system, and I should say it said that about myself. Any living organism, you can think within the organism, the biological system that operates within that. But obviously, trees are part of an ecosystem and a natural ecosystem, which is part of a system. So, if we were to expand on that further, what you can also do with systems is a system can be part of another system, so you can scale them up. So thinking of trees, living organisms, they're all part of the ecosystem in the planet Earth. And then obviously you can go even bigger and think, the Earth's part of a solar system, that's part of a galaxy, which is part of the universe. So you can always scale up systems, and systems are part of other systems. Yeah. So one of the when I've been preparing for this, one of the sort of seminal books on system thinking is this book by Donella Meadows from 2008, and through that she provides this definition of a system as an interconnected set of elements that's organized in a coherent way that achieves something. And thinking back to the picture I just put up, these are some of the sort of classification of systems from that, but there will be others. And the ones I've highlighted are the ones that I think are most relevant to the wider determinants of health and public health. So when we think about social systems, if I give these examples in the context of obesity as a public health issue, so social systems such as the family and community that people live in, that affects people's eating and physical activity habits through the social system that they live in. If we think about ecological systems, if we think about the physical and natural environment that people live in, that affects people's ability to be physically active. So that system is important when we're thinking of obesity as a public health issue. Biological systems. So again, thinking of obesity as a public health issue, what people eat and how much exercise they do interacts with the biological system within their body in order through the metabolism to affect their body weight and then the ill health effects of obesity. And then all these things interact. So people's biology, the environment that people live in, and their social systems all interact and contribute to obesity. Okay, so these are different ways of defining a system. So then if we move on to thinking about characteristics of a system. So if we're thinking about a system, what do you think are some of the characteristics of a system? So Michael's going to put up a box now, which is going to be generate a word cloud. So if you just type in there what you think or know are the characteristics of a system. So that can be any type of system, be a biological system, a natural system, ecological system, a computer system, a environmental system. What are some of the things that spring to mind? So yeah, this word cloud is going to generate, as word clouds do, the terms that people use the most will be bigger. So this is interesting. So in the word cloud, things are coming through around systems being complex. So that's definitely true. They're connected, interconnections, that's definitely true. Symbiotic, so that's interesting. Also communication, so around connectedness, relationships. So yeah, definitely all these things are true. Imperfect goals. Yeah, so that's really interesting stuff. So yeah, definitely some of what you're putting through this word cloud is what the sort of literature says when we're characterizing systems. So here's some of the things again from the book I've mentioned, in that characteristics of a system include that systems change, so change over time. So if those of you that work involves public health or social issues and or evaluation or research, knows that in the work that we do, things change over time. The other thing around systems is that adaptability. So a system will, along with change, there will be an adaptation to those circumstances, and there will be a response to certain events. There's also aspects in terms of systems, in terms of resilience, and also self-organizing and seeking goals. So I think through my sort of work over the years in public health, looking at complex public health problems, and even the work I'm involved with now as part of developing a research collaboration as part of a local place and system, is that what we observe is that, you know, nothing changes, nothing stays the same. So when you're working in a system or trying to address an issue within a system, such as a public health issue, what we observe is that things change and adapt. So that means that if we're trying to understand a system and or intervene, such as on a public health issue, then we need to understand these characteristics, what is changing, what is adapting, as well as trying to understand the actual system itself. So being able to respond and understand these characteristics is really important when we're looking at systems. So they're the characteristics, and then similar is the parts of a system. So in this book, the parts of a system are really described in three parts. So first of all, you've got what are called the elements. So that's the stuff or individual parts of a system. So they're the really recognizable things. So for example, the reason I put the picture of football on there is that if we use football as an analogy for this, then in terms of football, a recognizable thing is the players or the football kit that the team wears. That makes it recognizable. But it can also be physical objects, people, or even intangible things like policies or rules. Okay, next you've got the interconnections. So the interconnections are the relationships within the system between the elements. So the interconnections, as was put in the word cloud, can be the flow of information. It can be the way energy or resources moves throughout the system. So again, using this analogy, you've got things like obviously within football, you've got the communication between the players. You've got the ball itself and the passing of the ball. And then finally, you've got the purpose. So this is described as the most important part of the system to really characterize and understand when you're looking at systems, because then you understand the overall goal. So for example, in the game of football, you could say, well, the purpose is to win the game by scoring most goals. And if that purpose was different, then the game itself would be completely completely different. So what I've put on this diagram also is if we think about this through these parts of the system through a public health issue. So if we think, I'm using the public health issue of obesity quite a lot because that's what I'm more familiar with through my work, but you can apply this to other complex public health issues. So if you think of obesity as a public health issue and the system we're looking at is all the factors that influence obesity, then some of the elements might be the physical activity opportunities within a local place. There might be things like where people can actually go to and be active in their local environment. The interconnections are things between those elements. So, for example, it could be how the environment, an environmental element affects an individual's behavior or a community's behavior. That would be the interconnection between the elements. But then stepping back from the purpose, we need to recognize in that public health system what the overall purpose is and the purpose we're trying to achieve through understanding that system. So as I said, that's a really important aspect. Okay, so I'm gonna pause there. I think we're doing okay for time, so we've probably got around 3 to 5 minutes for any reflections, thoughts, questions on what we've covered before. Sorry, so far. So the first section, just to reiterate, was just to give an intro into what we mean by a system and the characteristics of a system. Then in the next segment, I'm going to go into a little bit about what that means and how we can use that system thinking in public health. But yeah, I just want to stop and see if anybody's got any thoughts or reflections from what we've heard so far. So feel free to put those in the chat. Yeah, how can we strengthen links, i.e. different elements within the system? So that's Harrison's question. So yeah, I don't know if I have the answer to that, but yeah, that's a key thought. Sorry, we can't have a discussion around that, but yeah, we'll log that thought, and I'll just move on to the next section. Okay, so as I said, in this next section, I'm just going to go on to sort of the application of system approaches to public health. So I guess the place I'm starting in this, and you may have come across this before. So what we know today is that the world we operate, live and work in can be categorized as volatile, unpredictable, complex and ambiguous. So what I think that means in this context is that sometimes when we set up a plan or a program, such as a public health program, if we set that up and just keep it static and linear, and we don't adapt it, we don't try and adapt it to the changing context in which we're operating in, then it's unlikely to be as effective as if we did change it. So system thinking and system approaches within public health, thinking of those aspects around systems, around adaptability and change, it's really important just to reiterate again that we're understanding the system context in which we're working in and how it's changing and adapting over time, because we operate in this VUCA environment. So that's like a wider context of why these approaches are important. So when we think about whole system approaches in public health, these can be defined as approaches that consider the multifactorial drivers of public health issues. They take coordinated action across a broad range of disciplines and stakeholders. So, as we know, those of us that work in and/or do research on complex public health issues, in all circumstances, if you're trying to address not just the consequences of a public health issue, so for example, thinking about sexual health, we're not just focusing on treatment of sexual health, but we're trying to intervene on the behaviours and the causes of those behaviours. We need to interact with people from a wide range of disciplines and other stakeholders, obviously particularly the people, and work with the people and communities that are affected within that. So all of these things are really important in terms of a whole system approach in public health. And also we operate through different levels of governance. So we need to involve frontline, we need to involve people doing the planning, and we need to have that strategic senior buy-in. And also often on whole system approaches, we can't just focus on one particular age group. We can look at systems that pertain to one particular part of the life course, but often in public health systems approaches, we need to look throughout the life course and look at how, whatever the public health issue is, how it affects people in terms of starting life, children, young people, adulthood, going into older ages, and obviously also the interactions in terms of the social systems through the life course. So in here, this lists some of the benefits of taking a whole system approach. It can help us understand the root causes of a complex public health issue. I think particularly when we're taking a place-based approach. So thinking about, for example, mental health problems in young people. I know I've seen bodies of work, I think it was work done in London, where they took whole system approaches to addressing that. So what are actually the root causes of that affect people, young people's mental health in a particular place? Obviously some of these reasons are global or international, but some of them will be local. So really understanding, taking a system approach, system thinking, and other methodologies, which I'll go on to, can really help us understand what those root causes are. By understanding the root causes within a system and the interconnections and the elements of a system, it can help us understand where we can have the greatest impact, because we can't, within a system, we can't intervene everywhere at once because we've got finite resources. So we have to decide where to focus our efforts and intervene to have the biggest leverage effect within a system. And talked quite a lot about adaptation. So understanding the system and monitoring it over time will help us understand where we need to adapt and change the approach. And obviously through often through public health work, there can be unintended consequences, both good and bad. So through some methodologies, particularly thinking from a research or evaluation perspective, if we take a simple research and evaluation methodology, we may only measure the intended consequences and whether they've been achieved or not. But through taking a system approach, we can start to look at we can incorporate things such as evaluation methods, where we start to plan, predict and prepare, and also monitor and measure unintended consequences. And then by taking a system approach and looking at where we've intervened on the system and also where we're having an impact, we can start to look at the sort of cumulative impact of different interventions within the system and how they relate to each other, and the ripple effects of intervening in one part of the system onto another aspect of a system. Okay, just pause there. Any thoughts or questions or observations from your own work around what I've said today? Maybe feel free to put any thoughts in the chat box, and then we'll have another go at unmuting, see if that's possible. Okay, I'll crack on then. So in the last section, what I'm going to do is go into a bit more detail into actually making this real. So talked a lot about the theory about introducing what we mean by a system, a little bit about what system thinking is and its application and benefits within public health, and then going a little bit more into a couple of examples of methods in terms of system approaches. Okay, so as with everything else I've covered so far, there's lots and lots of information available on the internet with regard to system approaches, including the evaluation of system approaches. One of the useful ones that's been published in the UK in recent years is the NIHR Public Health Research Programme has actually produced some guidance on system approaches to public health and their evaluation, and that's published in two parts. So this is a diagram from the part one, which is introducing system thinking, and then going into a little bit about the methods. So I guess what I've tried to put across is I think system thinking and approaches are something that public health practitioners can apply, and it can be used in an evaluation and research setting, and these methods are sort of interrelated. This diagram is communicating that the methods that are available range from purely thinking, so thinking as an individual about your own work, your own practice, and the system it operates in, and trying to gain that understanding for yourself, thinking about the bigger picture. Right through to the other end of the spectrum, where there's obviously complex and very technical quantitative methods that can be used for system mapping. So for example, computational models that can model using lots and lots of data to model changes within a system. So I'm not going to go into that because I've got no expertise on that. Through to innovative approaches. So an innovative approach may be obviously new approaches, but also where there's a combination of more quantitative, such as computer modelling of systems, through to combination with qualitative methods. Because often in evaluation of systems and public health approaches to complex public health problems, you need a mixed methods approach to the evaluation. But what I'm going to go into in a bit more detail is a couple of examples of the qualitative end of approaches to systems, because I think particularly for practitioners, they're a lot more accessible and they're things we can do with current resources. I think perhaps more the computational modelling type of thing, in my experience, they're not very accessible to a public health practitioner. And I think it would be interesting from a research perspective to look at how those computational type models can be applied in the data, for example, that is held in a local system, such as in a local authority setting around things like obesity, physical resources, environmental issues, how they can be combined to help us map and model and intervene around a public health issue. But that's rarely done. So one of the first methods I'm just going to touch on is a method called ripple effects evaluation. So where I've used this in part was looking at the evaluation of an intervention around early years and food, which was part of a bigger program to intervene into child eating habits as part of a bigger program around childhood obesity. Okay, so this method was actually originally developed as part of community development in the US, but it started to be applied in public health approaches, and in this case that I'm going to talk about as part of system approaches. So I've referenced all these papers in the slide at the end. So in the recent paper 2022 by Nobles et al, what they introduced was how ripple effect evaluation can help capture some of these aspects of a system that we've been talking about, particularly when a particular intervention is done in a systems context. So in this case, what the application was the evaluation of a whole system approach to changing physical activity behaviour in the UK. It was actually in Gloucestershire, if you read the paper. So what is ripple effects evaluation? It's draws on the concepts of appreciative inquiry, and it takes a participatory approach. So it's a workshop-based qualitative approach where what we're trying to do is map out the ripple effects or the consequences of an intervention that sort of ripple out from that. And how that is done is through group interviewing and reflection, and then a visualization of the impacts. So in this article, what's quite nice about it is they talk through the process. And so what I've done, I've just selected some of the diagrams that are within that research paper just to help illustrate the process. So as I said, it was a case study evaluation of a physical activity system. And what they did, they worked with local stakeholders through a series of workshops to visualize the impact of the intervention and try and really capture the impacts that are beyond those that the specific intervention was trying to achieve. So these are really the ripples that go out, because often we might just seek to evaluate, and maybe we'll map it out in a logic model, which is another tool, which is for a specific evaluation, but we don't capture the other consequences that ripple out from a particular real world intervention. And by measuring these other impacts, we can really see the wider system impact that a certain intervention or interventions or program has had. So you won't be able to read this, but this is really just to show that what they did, moving from a handwritten ripple effect map, as they call it, which is against a timeline. What they then did was put that into a certain free software, which is listed in the research paper, and they generated a research map. And what you can see is through the series of workshop, they really identified lots and lots of these activities and then impacts from a specific physical activity intervention or set of interventions. So this one then goes into a, if you like, zooms in into a bit more detail on that. So as you can see, this aspect there, looking at increase in cycling, and then what they've looked at in this, they've identified that one of the unintended consequences was that people noticed that there were safety issues with the local road, and because of they were doing this intervention in real life, they then did something about that. They spoke to local councillors, and then there was some actions to try and address road quality. So although the intervention was around improving cycling uptake and skills for those individuals, there was these wider ripples in terms of environmental consequences, and they started to map those out through the program. And then what the paper then goes on to do is describe how you can then map out these further unintended consequences and the broader ripple effects, and identify numerous both positive and, I should say, negative ripples that rippled out from the intervention to help evaluate both the intervention itself, its impact, and then importantly, from what we're talking about today, how that intervention contributes to the wider system and public health issue that you're looking at. So in this case, because they were looking at physical activity and the system which impacts on physical activity through the lens of system thinking, what they did, so a further extension of this is they then mapped out these impact pathways and ripples onto a system map, which is the method I'm going to talk about next. So yeah, the other method that I've got experience with in practice is system mapping. So this is the sort of main method that people probably think about when they think about system approaches to public health and evaluation of those system approaches. So this goes back to the Foresight Obesity Systems map, which looks super complicated, and can you ever do that in real life? So I've actually applied this in real life on a certain intervention, but I'm going to talk through using a paper that I found quite useful. But first of all, the more technical way of describing system maps is causal loop diagrams. So you'll also hear system maps referred to as causal loop diagrams. But again, system maps themselves don't need to be super technical, and they can be very much, you start off with a hand-drawn map. You don't need to have any quantitative aspect. And really, for me, the benefit of system mapping is bringing people together who are working on a shared public health issue and have got different experience. You might have people there from the healthcare aspect, you might have people from the environmental aspect, you might have people from the behavioural aspect, you might have people there from the local community, you might have practitioners, and they're all bringing their experience and understanding of the system and the factors that interact on this system. So it's really people qualitatively working together around a table and drawing the interactions, the interconnections between the elements in the system that affect that public health issue. So it's getting a shared description of that public health issue. So this paper that I've put up here, which is a recent one, sort of describes some of the benefits there of developing these system maps. And then this is from that same paper, just to say, if you do want to get a bit more technical with this, and there's actually quite a few free training programs online on causal loop diagrams, and the elements within the causal loop diagram are the causal loops themselves. So in this diagram here taken from this paper, it's sort of breaking down a couple of basic examples of what causal loops are. So for example, in this case, they're looking at sleep and depression, and you can see the loops are sort of saying that sleep problems contribute to depressive symptoms, which contribute to sleep problems. And the pluses mean that there's a positive, one contributes positively to the other, i.e. increasing it in a feedback loop. And then if we look at treatment, if we intervene with treatment around the issue, then there's a negative, i.e. treatment would decrease the depressive symptoms and sort of intervene in that loop. So just a very basic sort of introduction to say the component elements within a system map, if you do it a bit more technically, are the causal loops themselves. So if now we look at an example of a causal loop diagram. So this is it's from nearly 10 years ago now, but this was actually, so again, I think this is a really good paper which talks through the doing of a using of system approaches, and in this case system mapping, to understand a local system. So in this case it was it's research done in Australia. I think it's in the south of Australia, and it was basically a local obesity program, and in this case they brought the stakeholders together to look at the factors which contribute to physical activity to generate this system map. So I'm going to attempt to zoom in a little bit on the map here. It's going to be a bit blurry, but on the next slide I've got more of a built up slides. But what you can see here is that the elements that we talked about earlier are linked together, and what they've done on this map through the stages of the system mapping, they put the pluses and the minuses on there. So they've started to look at what are the different elements within the system, and then what they've done, they've characterized the different parts of the system in terms of how they've drawn up this system map. So they've looked at it in terms of sport, physical activity, they have looked at food and social influences and general physical activity. And then, as I say, they've really then gone into how these different parts of the systems interact. So on this side, I've just zoomed in a little bit in terms of one aspect of that, the social influences. So if we were to pick up a particular aspect here, so for example, if we looked at the ability time to cook meals, we can see that parents who can cook is having a positive impact on ability to cook meals. They also felt that things like buying fresh food impacted positively on time to cook meals. But interestingly, they put there was a negative association between ability to cook meals and access to processed food and access to processed food. So why this method is useful, just stepping back again, is that by getting this system map through work with those multiple stakeholders and from different disciplines working on a complex public health issue, it helps us understand the system issues in that particular public health issue, and then moving it on to the next step, it will then help us identify where to intervene by understanding that system, and then thinking about the ripple effect evaluation. Then if we intervene in a certain way, we can then document on the system map about where the ripple effects have been. And if we've got a big program of public health work where, for example, we're doing work on participation in sport, maybe we've got some initiatives going on in fast food, something about the social influencers and other things, we can map out where we've got all these interventions and points of leverage. And then where we've got a lot of activity, they're like our key points for leverage, where we feel and understand collectively that we've got points for impact. And then what we can do, we can monitor over time where we're starting to have impact using this diagram. And we can come back to a diagram like this through our, assuming we've got some sort of stakeholder group, and we can see, one, going back to what we talked about earlier, where the system has changed, what are the other factors in the system that we need to take account of, where have we intervened, and then if we are evaluating these different impacts, the different interventions, we can then start to get an understanding of the collective impact of our program across all this mapped out system. So for me, I've produced a system map before in terms of child obesity, and it proved really useful in getting that in a basic way in terms of getting that collective understanding of the public health issues. So I think system mapping, as I said, it doesn't need to be super technical, and it's definitely something that public health practitioners can do. Again, for those that work in the field of obesity, you'll probably know that there's a whole system guide to obesity, and that talks through the process of system approaches to obesity, and again that advocates system mapping. So again, I think this and both the ripple effect evaluation are examples of evaluation methods that we can use in practice, but also we can link up with academics to help us evaluate those. And as I said on the previous slides, there's also more technical methods that we can use that I won't be able to go into today. So yeah, in conclusion, hopefully what you've gained from today is a little bit about what we mean when we're talking about systems, a little bit about why that's useful as a way of thinking, and the benefits of that within a public health application around complex public health work, and then a couple of examples through ripple effect evaluation and system mapping that can be helpful both in public health research evaluation and practice to help us address complex public health issues. So that's what I wanted to cover today. As I say, it's very much an introduction to this. It's perhaps something that as a HDRC we could go into a little bit more, because within each of these aspects we can go into a lot deeper and bring in experts in those fields potentially to go into that. So yeah, I'll finish there, and as I say, I put the references on the slides that I'm sure will circulate, And yeah, just to finish off, that is our HDRC website. We've got a series of these webinars. If you're not familiar with them, please sign up to the HDRC newsletter, which you can do by emailing coventryhdrc@coventry.gov.uk, or you can see previous newsletters on the Coventry HDRC website. But Michael, do you want to come back on? I think we've got a couple of minutes only, but yeah, welcome to take any questions if and discussion points if people want to.
Thank you very much. Have we got any questions, anyone? There's something in the chat. So,
is there a system approach project currently in Coventry? I don't know. There probably is, but I'm not aware of it. I'm sure colleagues working on public health issues in Coventry have at least thought about it. You do need to plan in the resource and time to do it. And there may well be some research, but I'm not aware of it. But yeah, I'd be interested to know.
right. There's another question.
How do you manage the resource and capacity taking a whole system approach? Yeah, so what I'd say with that is it's like you can only do as much as you resource you've got. So it's sort of like a strategic decision, I think, on a public health issue, that you take this approach as part of your central strategy, and you need to really plan your resources to it and get buy-in from stakeholders. Otherwise, it really won't come together and have an impact. It is a challenge, particularly because of that need to resource and plan it. So I'd say the best time to do it is probably at a time where there's going to be a review of the strategy or policy or approach, and really start to plan it in and consider that as an option as part of the sort of strategic planning cycle.
Do you have any other questions? Just give it a minute. Okay, looks like we're done. So yeah, thank you very much, John, for this session today, and thank you everyone for joining us today. Please, as John said, you can sign up for future webinars on our website, and we'll see you next time. Take care. Bye bye.
Thank you. Bye.
Yeah,